When assessing abdominal pain, there are two main ways to describe the locations: quadrants and regions. First, we can use the abdominal pelvic quadrants, and they're going to offer a general way of describing location, including the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Remember that when we describe a patient's anatomy, we are always using their perspective and not ours. That means that their right is on our left. That's why the diagram is labeled in the top left, the right upper quadrant, because it looks like our left, but it's that patient's right. It is necessary to remember this because this is universal across the entire world. We always chart and document using the patient's perspective. So the quadrants are great for generalizing where pain or discomfort is located, but if we need more precision, we're going to use the abdominal pelvic regions. This system divides the abdomen and the pelvic region into 9 different sections. Starting in the superior right portion of the abdomen, we have the right hypochondriac region. The prefix hypo, it means below, and chondr means cartilage, specifically referring to the costal rib cartilage. So this region is inferior to the rib cartilage on the patient's right side. Medial to that is the epigastric region. The prefix epi means above, and this region is superior to the stomach. Lateral to the epigastric region on the patient's left is the left hypochondriac region, also inferior to the left costal cartilage. Inferior to this is the left lumbar region, named after the lumbar spine it aligns with posteriorly. In the central area of the abdomen is the umbilical region, named for the umbilicus, or navel, which is our belly button. Lateral to that on the patient's right is the right lumbar region, also corresponds to the lumbar vertebrae. Inferior is the right iliac or inguinal region, named after the nearby iliac bone of the pelvis. And in the inferior middle is a hypogastric region. Hypo means below, and gastric refers to the stomach. So this region is inferior to the stomach and centrally located. Finally, lateral to the hypogastric region on the patient's left is that left iliac region, which is also aligned with the iliac bone. Understanding which organs are found in each quadrant and region is essential for Anatomy and Physiology 1 and in healthcare. These terms are going to be used in both anatomy and clinical settings, so screenshot or save these charts that show organ locations. So don't forget to like and follow for more science content. See you next time!